Rick and his family moved into the McCall area during the real estate boom. He developed GI problems, but had no health insurance. The community free clinic stepped in to assist him.
Well, it was $1,800 for the colonoscopy doctor and $1,500 for the hour and a half I was in his little room right next door. And then the pathologist wanted $530 to look at the 5 polyps he hauled out to make sure that's what they were, I guess, or these are cancer or whatever they do. No, they paid for that too. Yeah, so I mean, I figure it was at least $5,000-$6,000 worth of stuff, you know. I had no idea that well, I didn't know it was like $3,800 just for your bare bones colonoscopy. And he mentioned, he says, I'm going to have a lot of trouble. Because they counted like 21 or 22 of these pockets, diverticuli, I guess you call them. He says, I'm going to have a lot of trouble. It should just take like about the last 1.5 feet and cut it off and reattach my colon. And I said, well, that sounds like about a $50,000 deal or something. I don't think I can do that. He didn't say a word, and I never heard another word about it. I said, I don't have insurance. I don't.
Without health insurance, Rick declined colon surgery, risking increased medical problems in the future.
Mickey Waldo. I became unemployed at the time, and my disability started getting worse where I couldn't work. I couldn't afford the health insurance. My health was really getting worse, getting severe. Well, I couldn't breathe, and blood pressure was getting high enough where I was having chest pains, dizzy spells. I had trouble getting up on my feet, getting out of bed. I didn't have the money to go to a hospital. A few times I needed to, but I couldn't afford to go without insurance because my blood pressure was so high. They thought I was going to have a stroke. Well, it's totally frustrating when you want to live a life and your quality of life has gone downhill just because you don't have insurance or money to pay for the medication or the doctors. You kind of quit living. At the time, my arthritis was so bad, inflammation was going through my body. It was starting to affect my vital organ. If they hadn't sent me to a specialist and I'd got the medication, I probably would have died. They helped me, the doctors helped me where I could get on my disability and get Medicaid. Almost a year to get the Medicaid from the time the clinic started help. I went to the clinic.
So your children didn't have insurance too for good periods?
No. They did after they started the CHIPS program. That was a few years before they became adults, which was a good program for children. Yeah, that helped out a lot. Some of the insurance they offered on the job, a man couldn't afford to pay his bills once you paid out. They'd want like $400 extra a month just to have your family on it, on the insurance. $400 out of $8 an hour takes a lot of your check. I just hate to think of other people out there, even the elderly, that can't get the help they need or the medication because it's too expensive. Their lives depend on this, and nobody seems to care. It's all about the money, not about the people in this country. Humanity's gone. I hate to see people suffering and dying just because a few pills could save their life every day. Everybody deserves to live.